Donko abo wo Costa Television do into donko kasebo na bre na waso na nwabere medre boso mo home na nsama obidi no mu akwetini benye de waye cheche da mansanchofo dam roba ya se wode wonen nsam rugu abo na obadwen nyimpa ni yeye ho damara so na omam pain message professor gen no opoko agyeman akaya da ya da meje enanum kramofo de ochina wahwe na wode da mendama no wode dijuma damara so na wode afutu empayimfa woye awofo nye abatan da ma oboboa memesafo wonye di akodo no wetum wabo hon ebusafo eyi na nsem bi a akaw na nwabere medre boso modon kure kasebom na nsem na baye odo no akoye ya yamfa ndase papa omno yamfa ma nesto ventures asa benta bakete se ba se wudem na ya guy pa ente of the television eno onye no sound system papa bi fan na kan electric iron za abana so ya enye bi owufie a obaye akono asede bi so wa yamfa ma diesel gift shop diesel de taze na charge na ebusuafo no hu na mpa enuado na yankodan odahwala tene honomu yafa sede bi so yamfa ma MPA National Petroleum Authority osi use gas na gas de oya affordable pa edibokwe wona dawo ma na nyabe we somasen mamede donko kasebo mede brawo abafam kitikeku ASORBA KOFI ESSUMAN afi yanje na yanje nsama nemu nchechirum iku a wanhye abanase meche CDD waye ncheche sonko da mansamchofo da mrobe ya se impo wugina oye woni efrido do ye TV do ye radio anaso mpo do obakate na se wode won samru kwa abana obonwe nyimpa ni yedzen meche fundamental human right usande nyimpa ni yedi ohia papa non ka bana de edi ibi pa bi ne yimbo twitwu fom eyenti waye nsamchofo oye ncheche sonko de mansamchofo ofinfi mantoman kwanchefo peina odano wo oye CDD nsamchedwuma ana CDD bra obaye nsamcho obaye ncheche de mansamchofo no wiwe ni Costa Television yi peina odano bonka obi sende ana adibedini sunsuando no ohunu dat na ncheche ma omenu ibi
in the program I the journalist as the fourth estate of the republic, they were engaging on adopting a human rights approach to journalism. Basically, you're concerned in there. Normally, when we are reporting news now, I think sometimes we seem to forget who the news should be about and who it is for. Because most times now you focus on news not as to what advances the interests of citizens, but more focus on actors and political actors that whose positions we are sharing. So as a media, and why the media is a fourth estate nature there. On your media, no job there about singing the government to praises, it's not part of the media's job. When the media's job is to critique, is to investigate and critique the work of government. Government has enough PR to do its own PR on its the job. And it's a government as media persons, we should be able to look and ask questions there in the interest of the state, in the interest of the citizens. So I say, well, spend about 200 million or they see Dana. I think beside there, Dana, I should Dana 2 hours of. Or also they use 200 or the year, because then we are holding the government accountable for how you spend our public funds. And I think that should be the focus of the media. Our media they will focus more on protecting the interests of society from the abuse of state and also from government. And also count there. Most times also when we are reporting on news that will affect minority populations and our vulnerable populations now, maybe sometimes for sensationalization to me there news not in a balanced way. We are more interested in obey quick sell, obey clicks, But at the end of a reporting a day, we should understand there. At the end of these conversations or these publications, that there are real human lives that are being affected. So we need to be very conscious that the things we publish there as journalists, they don't incite unnecessary hatred towards any group of persons. We have the right to be articulate there. We can be balanced. If we have issues with things we don't agree with that, and they are reporting and the balance in the way there on course will be to stand on what we publish there or by a harm to any other Ghanaian. Don't forget that the rights, human rights now, they are guaranteed to all persons. Constitution say all persons. Constitution one can be in and BCR and Aquada say all persons. And try that constitution operated in whether may be our own pair and I be a member. Constitution doesn't deal with that or deal with what it wants us to what it seeks to protect, and that is that of protecting from abuse, not only from this from state but also from society. It's a detriment to the work of journalism. We politicize unnecessarily.
Yes.
The reportage of our craft. On the chair there. If Ujumana is to inform citizens, and every time any that there, Obi Wahona, because of bread and butter issues, on your time don't be reading news. On your time don't be maybe to no at in line but could be aka, not therefore only opinion. But the question with they be Sunday, that information is it credible information there? It will allow them to be able to assess the state of themselves and of the country. So it's very important that when we are reporting, we tend to be very balanced. But the politicization of media houses has also become very problematic. And also no account for the reason that even though Ghana, we have a vibrant media space now, in terms of information now we produce, it become politicized, and it has added to this high politicization of Kromoha. Certain radio stations and TV stations, either all come for MPP and all come for NDC. But the question will be said there, what about the citizens? Citizens now, criminal one they know who is talking for them. So we need to be very intentional there as media people. We need to recognize the importance of what we do as media people, and that is, like I said, is not to sing the praises of government, is to see how we articulate the views of citizens to the government, so the government will understand that this is what the people that have entrusted us with power this is what they seek from us.
Na owa maka kase wie na opinion William Nyako na so oye enuanom a woden cheche ni bi odema oye nsamchofo ono nti Coastal Television ya yin bonko bi said da no so ohunu wo oye ncheche a wodema nsamchofo na da owa William Nyako na so kan no ibin
Inti sa wo me chira wa je e was emrano aye wo e support sa ke bi ma me enu nti na ya maintain to constitution wa ko fe trata ke se mu a chapter 12 ko na media no ko juma mo ba ya what say even kasa ya me no kasa se ene wo kasa wo de be wo de beto abonti ama eni ba be ebeti enti kisa de kasa wo ko nso na boy media wo betimi aka be ana so wo be ba wo platform aka be ka be ya anya no ko e fo enti 1992 constitution America said especially the media. No, not emirati wo the friend of criminal libel. Criminal libel a year. Emra na wo kwa British for no ni ba. Tawo na they pray for independence. Na British for no say the bekasa. Enti sambra no lose. It will have media omon pa na de mrano amwa The American chapter 5 provides freedom of speech and expression. So, into the American into some time, from 95 up to 2000, now the journalists, most of the journalists are there, don't go prison. Okubako, Haruna Tamo, and other journalists, some of them contempt no use, but that's an also here. Adiana Kasa, who can be bina and yellow correct, and answer a bank is a yellow correct, near the prison. Kutia, I said, Samra, the Bimam Kabiaba, and now dear Samra, the German war, a bit in because I don't remember my mom for any money. Enti Samrano, criminal President Kupo, a winning election 2006 months after that. And now, Satana, and I don't know Attorney General, and the year very few. Now, sometimes the year, I was anchor and Maraba could be a count for publication of false news. There was set and also the year free because. And also, a mama, Omu used to Samrana, Obetina, Betina prison. Utility, and I said, Casa, I will be Mem Mamu, and he said, who can be being in Korea, and he said, no, local prison. Now, who can be being in Korea, will be more. When now, a Benipa, and I saw a private person. The free people civil but over court the information what can be here now the trial court I don't know Sika and Utia now said your reputation I said now they are restored in a certain sense it is our the I don't know in the year 2001 I was set for publication of false news and so you can but it's hard not for concerning criminal life because many use against journalists. Publication of false news across politicians most don't know use against each other. But up to now almost all against journalists and then be a social media commentator. Say, keep about the was some ran a publication of false news. He said, journalists, young and a man, the Nippon platform, and our politicians who so went to Amuna, so was here before. Now, so Obia can be here, and our full senate. Now, you're going to go. Most of the time, fine, secure, at the same time, I was making sure, the one who so the hour can be here, making sure, they are okay. They are now. But the fact that one can't open the name and say,
Ejanum enanon kama for the four papa ebena that shall come ashe ewia enyim wo oye baya ndakakra abesin kwe na adum de ma ochina na wode de ma kwanchiri na dere be wieyi na wode de ma kwanchiri be wieyi a na akaye no afarbo sonkokra de ma fidi da no di nti amampan chantra mani mahama feyin kweja otodo ebien ayen ne panyimfo nye ne srafa ohwe ba mmon samodo eje ne tumodo na wa hyede ochina ya ahomeje da sonkokra yedibedi oya sala wo ejanum enanum kamofo hunedinum wonka musumu no onya bandama na chi ya boba fa ache yankopon de wa kwanchini na ewie no nya fa bodin da yedere kan eda ba fa no oni nti ekọ nkamuma ye fa na be sabele la ena ta baby ashe yankopon enyimnyam womboa na mpempenda oduwe bodo eyenti amampenye zechi Professor Jenan no opokwajiman ode se obiti de mafidi de ya ohia papa pada obate ne sa ya da yesonko na oda mejanum enanum kamofa wo finfi manto maha usan na finfi manto minyiba enti sa obaya do ye bia obohwe fiansa na wahwe bebiara odena do ye boko na bra ote de ma do ye kama janum enanum kamofo wo ogwa ha no mami enye koninti osoma na no twetwemucho na ba oyini nua preko pa oyini wadwumam owe magdari da bra finfi manto kogwa akwa kaka ogwa mensina soyi krachi panyin wo Honorable George Sisata hunde ma cheta amatere mankamofi wanje na umfenso mfanhwe akwanchi na ewiyi asoye no tronko ngomre ewiyi na bra wote da ma chade no kran owa maderia ogina omampanyin ezechi na nem zida ma chade no men nsama odi tugwa no yenhwe bi
ye ni jesem kesema ye ni anu muslimifo a nyame adoma otena enetia eye holy ramadan a wosase a wogutiri ano eye Thursday Friday no bu witiri ano na kasa ni nyina ne se apart from achede ni ti no ye na bi dia da se eye Ghana ha de yeti asomdwem Ghana ha de boni bi rensi na mom no oman foforo de sasem si wo a na fi oman Ghana ne yeso ade ye wo isi kakra obesha na ba me kasa wensi ade ade se da me se ye nyanu muslimifo na ye imam se wo bompa ya etwatwiri a won kai eye na no wo Iran na Israel entukwala esi wo ha eniti no eti eba be affect ye economy o mampeni John Dramani ma ba ya what is about the gbakwem esan say Iran one of the producing offense way oil ewo hunti it is gradually affecting the economy but just recently no fuel no adjust kakra we say na ye de ye hwehwe enti pabeni nyi eti na point ni minute no ye be stress eye otena na Friday si wo ko go to dwemi wasre Allah say what the children that be radio one say pabo one say asonde efama Iran say na be ya Iran to kana be the ekofoma na economy no so dey nyakwa dey ejina yi afen so yesha say papa o mampeni John Dramani Mahama ana ma me professor na naje opoku adima wo fu abenya wodi gbakwem a eku behia say Ghana ha dey ejimpa bodi yedi yankopon di ye believe say yankopon no bo soro ni asase ni me koso nya ona no dey oboy na so o de nyansa dey e mani pass ni pa fa say dey ngwakwem Israel ye pefo dey gbakwem say fata bo afan tai weti a na say dey otan ene tete me beta weti a enya dey result e pay 4 years ensa beka say dey pabo what's na pabo eye Ramadan AND afama eye mampeni na bediti na Ghana ha ministers na penifo nyina na party for na say na be ya eye asondwe a ye enjoy e o man Ghana ha no e be koso ya enjoy asondwe no na ebi aka ewiase afa na nyina
na onda mede odi the match ade no bosoi ogwa mensin asoi ni nti mensin krachi pen na ohwe ogwa no do onyamfo George Justice Ata na so oyo na no no de nsam de tugwa da za owa George Justice Ata na so kan no ibin
Oyenyeje Sam na His Excellency the Vice President of the Republic of Ghana Professor J. Nano Opoku-Agyeman na afimu biara oye yeni anu muzrami for one fasting na Professor Oze Nzema emo nkoko 150 bags oye angwa 50 boxes na other items including oye nentwi kesepa ozaka hu oye azafi bia oye na yebia yeza srem paibo yeza mai omampeyin na bezechi na oman Ghana nyinara ye nyina yinyimde ye na no Muslims anade Muslimifo afi biara oye fasting was a Bombay zema many obejina no many yakobi. Just as the Vice President has been doing every year, even in opposition. So I came on behalf of the Vice President to present, and on behalf of the regional minister to present these items to Muslims in the whole central region. In the central region, Muslimi funina there. One thing big, one fasting. Now, in the fasting, so Ozibibe was a man during their fasting and prayers. No way, so Ozibiaba. And I think that as a papa, a vice president no dan nyina oye ma yarkanye de ye piasomdwe e wo mani mo omampanyin His Excellency John Dramani Mahama na omanmu ni nyina yine de omboa no onhyehye nzema tutu nzema na omman Ghana onfa na champapa onfra. And the president is doing exactly what Yimpadodo no was a power man. Because yes, the sovereignty of Ghana resides in the people of Ghana. It's a Omanpayin, the upper culture social contractor on your Omani in our signing. The president is doing exactly the contractor on your Omani signs in precise manner. Now, Cape Coast, as a mayor, I can attest to the fact that the president has done a lot for the good people of Cape Coast. And I can mention a lot of the project on my pay, His Excellency John Dramani Mahama Bello, why Ozama, the good people of Cape Coast. So this year, we have a lot to do for the good people of Cape Coast. One notable one, notably, Echo Cape Coast baby or the New York. Or your man pay Mahama and Zane Joa. Baby and Kaziaso. Echo Cape Coast baby in Su or there when you Su one of Nobula another backer mechanized boreholes. Or man paying a year. School at the Olisi, hospitals Olisi, maintenance or year. Old project or abandoned on Ojenu or man paying or year. It's all President Mahama and the NDC government, we walk the talk. In the end, or you need Sampa or Zema or MP for Cape Coast South, them the necessary or respect, the necessary reverence, or the Yazamo. We support them. One pen farm or man, no man, no
Abaga chipeyin na odo da mensemi odo tugo wabra Professor Jena no pokwajiman odwenka mafun wochina wona salaben na odo da madoye odo kamohon na onam ochina ahomjeda na ye salaben kwete de Coastal Television yete jumedi sonko abobade enti ye nuaba ma Omar bin Abdallah akoba propo ahwede ochina himfo party ena ejanum enanum kramofa wo abra na nonkwado wobedi wonne salan na aprobono yehweda okrodo ne bi.
Assalamu alaikum warahmatullahi ta'ala wa barakatuh. Yamina dum yambo achina we are fana hinara Muslims o hina wuzi oya honafi oya Eid al-Fitr nti biara wo oya yuadin fana hinara wo hina wotum wuzi da mejumezi nti finfirmantom oya Ghana na no kwado ne so ibutum ebidibi da ma finfirmantom ne tire ogwa metia oya Cape Coast North and South ne yadumezi ne bi obutum akodo ana be Coastal TV yetum ya ba oya Ahmadiyya Muslim Mosque ye kan oya Abra oya Sekita na Abra Zona Mosque otumo so ha papa oya Abra Mosque ye ba bo hwede echina sayifi oya Eid wo oya Cape Coast Sports Stadium yes aheti ya ba oya Mosque ya ba ebe bi didem dwuma sonko na ye nyina yembo modin hye ne so de Mosque eto ye baba no nkoma pi nya no buto obokodo osane bibiara wo be no aso de ma oya kopon ne pe oya echina izini nya baba oya live YouTube Facebook no Coastal TV etum na akodo ye ko oya Mosque oya akwa nzama to be almost go say eba mosque as I butu ebuhu na obobo am otuma akwayim nti ya ba ya oya Abra Ahmadiyya Muslim Mosque on yetum na ya ba abakansa wa ha yehwa oya mosque no ya fiado otuma so papa wo sha si wusi acher papa na ye ka bera wudu oya mosque 1990 na wo boy oya mosque mempen fu pi tum ba abakansa boy madam ba bem hia otuma akodo sunsum kenzia da me bera wa Ghana how tuma boy ma oya mosque to boy ya no onye Movi Abdulwahab oya Adam anona da mebere wutum wudu boy oya mosque fitira mebere ya ebesibere mosques ahopi ngane etum na abado oya Abra ichire yetum ye kohene papa oya yemsom oka oya Abra community ika media for our Abra community will dominate the great part of our Abra community in time bo achina oya Eid al-Fitr nezi ye fi oya Cape Coast Sports Stadium yereba or oya mosque ha na achina ze domo wutu obahan bodos papa ye hwa oya asor dan ni so akwana afro wutum wosia anye me na masafe ya wutum ntenambom nti ye hwa abrosa no suru hina oya bia masafe wutum atena na oya asem so ye bia no so mayinfo ofibretu bi obo modern efi wutum no otena na ye kwa kwhwa oya asor de ma bia opinion obizaso na yihu no obamaze na fotum ogina wotum aye asori epeda yetum na yehwe ankasa motum no okwayim nti ofibere to be senti bentine aye muslims oboye mosque wonfa aye hompobo tum nkwan ni hina ohia na ofibere to be obamaze na fi etum na ahye so amawotum aboa nti sere no aye mosque na ebebure aha ye aye hon veranda ofibere to be no sabi erekwa asori dema obamaze na fi etum na iyi wonpobo ansana etum na aba aya asori dem na aba abaya asori nti eba abaya asori anwosesi ohia papa ebesisi ohun de ereba mosque aba abaya asori nti mpobo de sabi yentum na yenfa nko aya asori dem nti ye kwa akasha asori dem ezinkan bi aya wonpobo na efi etum ansana akwa asori dem na bibiara ye aya woman wotum use oya Quran echesema ansana ebaba asori dem no awoda wonsa wonan anyifa na woda zinkan waya asori dem ho na fi etum na ekọ oya weyim nti ye bebudu wo oya asori ne fi ha ofibere to be fi pi wotum na fi waya asori ha the biggest mosque owo oya abra ye kan na tere Cape Coast North and South mosque osopa papa nti da mebie ye bia apayina obezi asori n'enyim no obomoze na fi wotum na wegina na waya asori ana yeka che the Costa TV bobomoze na fi is bibiara etum na abro osena yere baba ya asori zo obezi enyim kana ofon oya imam no bia migine ano na obomoze na fi wotum na waya oya asori me bibiara etum na awiepe nti yamma moze na Costa TV yeba nhihye biara dwumezi biara bomoze na fi de amanfo etum na afom papa nti yamma moze ya hye so yemebo akina kotenze Costa TV di bibiara obutum abakodo no abomoze na fi etum na abra asori ne ze ne ye de ne ye ahmuka enyan ye kura no sabi merbe manfa oye echewo entum afa ma na echewo wo oye asori ne ye ohia papa nti amina dum ebu hande mede wo chewa ahye kotenze na ja son anonti ina yetu ya baba kansa wa ha nti ahosesi de mbo akina abodoso ankasa wa ya asori dem ha nti mamade yan hye no so de di biara ya mbo akina abokodo ho no ya mamade yan hye no so de Costa TV de bebra oye tefu yan hye no so de bobo mamade ya hwehwe abakosam ebira media baba kansa wo oye finfirmantum ogwa oye abra Cape Coast North ababa kansa wa ya abra aba afi na asɔn baba kansa ebiti abakɔsam kakra asɔfo pii nya no ababa ka nsa wa ye abraha eba moze na fi etumi yete kakra dama so medumedi pii nya na aboto abakɔdo no eba moze na fi etumi yete oye ni hinara mesafo ku a wa ha wosofon legend maila you were meant to go phone ya hudam la media you were paying for wa 40 years and above ofron oye ansonela the men pay fi you were nasrat you were atfa sente bako de mezi ni hia to muka oye media hono hyehyɛ ho eba maze na fie tumi ete mesenesi Omar bin Abdallah oyo tumfu ala ne pia ekyenase nkoma pinya na obutum no akodo wo oye mosque ha shane so de yamma maze na fie ntumi yan shane so ye ba sori de ma za ibitei oye ne kasa ni hina yo oye imam nti wo si switch off your phone ohia papa osena sabi are ya asora inda oye phone so oye distraction oba osisisu oye waso enti na ebohwe na wodo dem hia etum na atetar oye mosque ha butum be hia television set is part of oye asora nhihye otum na oye osena iye hinsusum kenzin the whole world of Britain etum ya hwe oye no so na kasa no komobo of Britain otum na kache iwiade fa na hina ye hina yi wabanizin yekura owo iwiade fa na hinara the man soon you were banzi crowd the whole Ghana no so autumn no adano into hina no bibi sempanyimfo there bentine aya iwa banzi wo radin fa na iwa banzi yekuru wa Ghana hiara iba regional bisudan no iba ni hina ho se iba mazina yimpanyimfo etum ezinkom nta akina the Costa TV Bamazinara na hwe za obutum no abokodo capital hro wa so de hina ya capital wotum na wote ya aya asor nti ahwa ibu ahyanso a ode da no aka okire aya mosque ye kire eto capital na mpa bia badan na enyim etum na ezi ni hina ujado otum ya asor sasabi sa enkite bi na ya etum eba asor nko a nya za aya infumudo kra nti yema mazin ya hyan so de yembo akina se Costa TV ijumedi ni hina baba kansa na efi tuma bompa yefipi na ye obizi nkomo wo ye mosque ha nti arba sora na abantam ifi ida na aba so ntam bebiara etum na adwudwado ye man kwetara meba me oye onua ben na he chief driver mos the mouse na oye eje inde na ya aba bohwa za otuma ko ye mbo akina izi bia butum na aba
Awobabua ma ochina Ramadan esum no bokwadon one na Umar bin Abdallah wetwe mfanyin de amahenen na yenti ade na emfa nsam no mfa ma wodon kor kasebom wo Costa Television a apomedina seye na fa owo finfimanto ma ha we bu no kompo wa hwe wonachiri de yesa afiase busum pop ibasa na yewuemi na busum ibasa ntem no abona seye orokonanyim ana orosan nachi ana mpo mmodere ba olobon orokofom eyinti bra wo bu no kompo na wakatena asem woye hwehwehwe aduma ahorupi hona woko aba no kaye aduma hono mpa wotete office wo ye aduma na ayasabi ahorowa owo fifimanto ma nyina hono mmodembo oteden nurse fo mmodembo oteden doctor sefo wono mmodembo oteden aduma yefo nankese mpa hona wo papra hona wo sese wo so po mmodembo oteden eyinti kwanchefu peyina oda abodina soye anu wo fifimanto ma meta dete owura ye Alberta Brichim nyako odin sem tugwa na ochire me de pepeda ye didi oyala nte nase na odima manyame wabra wabo ban mabusure ba sentem woro kwano de obohwe mapomidi na adwuma etumeje na do pete na pampen na hene ma no Brichim nyako ne nsama okan no ebi
ya afibia ye no eya yetwa ye ni ehwe afia etwem no ehwe se dwumadi a yedi ye ewo apomudin afem no sen na esikoye de hin ne ko yie na de hin soso na yebetimi aye bibi afa ho ama na ko yie sen ya ekoye nti sa dwumadi ni bi na ne soso ye di wa ha na se ebu nkompo ehwe ye chi a yebeka se ma omukọ awo so a eya omuhwe omunkwa no last year ebi ewubro the previous year which is 2024 na enya de a ya na eyede baba akokra hwere ne nkwa abusua ni nyina abo na yebu nkompo hwe ye chi a yetimi bi se eya na ye hia apomuden aso eyefo no apomuden adwumayefo health workers and midwives bebre ewo yen region no ye san susu hia doctors a omo adwuma eye na ye friend obstetrics and gynecologists ewo yen region no kakra ye wono soso omo so yasene ama ya ye adwuma nenso so no mpem bebre no eya na nye nya na etimi ede nya ye hwehwe na ye pe I mean the good health outcomes no eba ebi wo kwa oba bi ho akire no ewo se eyi ni free bia health center ede ne ko bigger hospital enso so se be ye kra ye benya ambulance ne nya ne ntem so ama ni pakro ede akono na akwa ye bibia ewo ho ebi wo so ni pakro ohia moja ye region yi mu ye ni blood bank nti se base ye hia moja ede ama obi mprempren a se odofo bi ana se ebusuani bi ni ho a ni moja ne de no ebetimi afa na eno so akwa ye asem foforo amayen se yankasa make say yen ambulance service no me e 26 ambulances se 26 no emu 13 enye adwuma aka 13 pe na wo hese nya ye region yi esiti a na chese nkofo hu ka adwamu a ubeyi na free baby a ne ho akire no ede na ko baby a ahoje ewo no etimi ye bwachi bidi nti ye besre se aban M1 National Ambulance Service na ambulances a asay no ye repair na si ebetumi so ato emono so aka ho efiso hese nya ye kwan so tia ka na ye mono kora na eco speed a wan hwe ye be ko ba ko mienu nyensa aba no na ho den so ate nti ye besre ye hia blood bank so afi 2026 ade potin a esi ani so a ye pese ye na ye tire mu na ye hyemu kena ye ne ka ne bofo kasem se primary health care and ye the quality care and as a service a ye de ma ankwankwan bia ohia yarehwe eno so na etimi free apomden aso ye etimi kokopie nipakro ni fie kwan ano eno nti na ye chips eno nti na ye networks of practice eno nti na ye wo ye community clinics ene nkeka ho because ye dream say apomden eben wo e wo baabi a wote a o responses and as o outcomes for health are very good inti primary health care ni e pese ye make sure say emu ahyeden pa na se etimi ye no so a new policies our government they but it's a free primary health care no ebenya ingina so pa e de agina so ama finfim ha sei finfim mantem ha sei efo ho atọ mo ayarehwe afutu a mede ma health workers nyina ne say de bia yenye ka say your health are concerned na che say mantemfo anasa mensimfo no mo health ye concern but say yen so ni ho a yentimi enhwe omo yen so ni ho a yen so abusuafo bebre nti say no yen so ma yen health enye yen so ye concern nti nhyehyɛ ahodo a yɛde ato akwan mu sɛ ebe ya staff betimi aye physical exam e wo hospital omo be take advantage of wellness clinics na nkeka ho sɛ ebe ya enye sɛ ugina ho no atwa ahwe anase nani ese ne ho yen so so ade akyenye na wada ne benku so nti ebe ka sɛ ya so so yen hwɛ ya pomodin yie
na jubetina sino director general de ma apomdina soye meche Dr. Samuel Kaba Akuriye na so odne me kopo echi na nsama doctor na so ditugwa no ibin.
This annual performance review meeting is an important tradition within our service. It provides us with the opportunity to reflect honestly on our performance, examine lessons learned, and reaffirm our shared commitment to continuous improvement and accountability to the people of Ghana. I wish, first and foremost, to express my deepest appreciation to all staff in this region for your dedication, resilience, and unwavering commitment to duty. Despite systemic operational gaps, constrained resources, and often challenging working environments, you all have continued to deliver essential health services to our communities with professionalism and sacrifice. I also wish to acknowledge and thank our medical directors, district directors of health service, medical superintendents, physician assistants, community health nurses, midwives, and all other staff who carry the daily responsibility of leading service delivery at facility, district, sub-district, and community levels. Your leadership ensures that policies are translated into care and that services reach the people who depend on us most. I want to extend special appreciation to you, the Regional Director of Health Service for Central, as you represent the Office of the Director General in this region and serve as the critical link between national policy direction and frontline implementation. Your stewardship and leadership remain indispensable to the success of our service. Colleagues, the performance indicators from the past year at the national level demonstrate encouraging progress. Improvements recorded across several service delivery indicators reflect the hard work and commitment of staff throughout the country. However, we must also confront areas where progress remains insufficient. We must intensify efforts to reverse the downtrends observed in areas such as institutional maternal mortality, skilled delivery coverage, mortalities related to non-communicable diseases, family planning acceptance rates, and pediatric coverage, among others. These indicators represent real lives and family realities, and they demand renewed focus, innovation, and strengthened supervision at all levels of care. Our reviews must therefore be honest, evidence-driven, and solution-oriented. To ensure operations this year, I'm taxing all regional directors to assert their leadership roles with confidence and with my full backing. In these areas, maintain discipline within your regions, safeguard the financial health of your facilities, and ensure consistent availability of medicines, consumables, and essential logistics. Internally generated funds must be managed responsibly with deliberate ring-fencing for maintenance and operational sustainability. Keep close watch on underperforming facilities and districts. Intensify supportive supervision and remain visible on the ground through regular monitoring and engagement visits. I urge all regions to strengthen patient grievance redress mechanisms and implement practical measures to promote client satisfaction, support persons living with disabilities, and foster positive community relations. By addressing these positively, we can avoid unnecessary public controversies and maintain public trust in our facilities. As we look ahead, government will soon launch the free primary health care policy, a major initiative aimed at removing financing barriers at the entry points of our health system. This policy would cover existing primary health care services while prioritizing population-based interventions, including screening for non-communicable diseases, health education and promotion, community sensitization, and mobilization activities. We will soon embark on rapid staff orientation and training nationwide, up to the CHIPS zone level. I will count on your full cooperation to ensure smooth and timely rollout of this important national policy once launched. Finally, let me assure you, the regional director and your team, that with strong support from the Ghana Health Service Council, we continue to engage the Ministry of Health and other relevant stakeholders to address systemic service delivery challenges, including staffing constraints, funding limitations, infrastructure deficits, and equipment gaps. We remain committed to creating an enabling environment that allows you to perform your duties effectively. On behalf of headquarters and the Ghana Health Service Council, I wish you, Central Region, fruitful and productive deliberations during the 2025 annual performance review. Let us continue to serve with integrity, lead with purpose, and work together to improve the health and well-being of every citizen. Thank you for your dedication, and I wish you successful meeting.
Na dwumadina ase no wato sofra Professor Anthony Adofu Ofosu ono na lecturer wa University of Health and Allied Science asoye wato sofra nde ombra na mfa nyomatie chi na makasa mfa nche apomudin edwumayefa wo finfima ntoma na professor no so nsama okan wase ne bi.
UAC is a core component of the Sustainable Development Goal, precisely the Goal 3.8. Making it a global priority. Across the world and here at home in Ghana, universal health coverage stands at a crossroads. After early gains that we made, global progress has unfortunately slowed. Essential service coverage rose only modestly between 2015 and 2021, while many households still face large out-of-pocket payments at the African region, that the WHO African region. The UAC Service Coverage Index, the indicator that is used to track the UAC achievement, has stagnated and is even dipped from 2019 to 2021. Ghana has much to be proud of. We have decades of leadership on primary health care that is globally recognized and acknowledged. And social health insurance, our national health insurance, is one of the best things that ever happened to Ghana, maybe after our independence. Although sometimes people say otherwise, but it is one of the best things that ever happened to us. Yet, we too face headwinds. Ghana faces a growing double burden, like all the developing countries. We have non-communicable diseases now accounting for roughly 45% of death, even as infectious threats persist. Maternal mortality has improved dramatically over 2 decades, but stands unfortunately now hovering around 234 per 100,000 live births. These are mothers, sisters, daughters of individuals, not just numbers, lives that we can save. The key thing is that financial protection that we've done and we've improved with the national health insurance is eroding at the margins. Recent analysis using Ghana Living Standards Survey and the annual household income and expenditure data, when you analyze it, it shows rising catastrophic health expenditure since 2012, especially that is sad for the rural people, for the northern part of Ghana and low-income households. Medical supplies and inpatient care are the major drivers. Earlier work that have been done by several researchers has signaled that while average catastrophic spending incident was low at higher thresholds, the poorest households still bore disproportionate risk. a warning to us that the broad averages that we have can still hide very deep inequities, so that we need to seriously disaggregate our data to identify the inequities and address them going forward. Coverage, Reverend Prof. Chairman, coverage without quality does not save lives. We have concentrated too much on coverage over the period. We have done very well with coverage. Skill delivery coverage very high, antenatal coverage very high, but mothers are still dying. The answer is in addressing the quality.
Na mokrebi mankebidi aya na awomoti enti opeyina ono ohwe oye amenso no nkita wudido mekire human resource person HR wo oye Ghana Health Service asoi wonkran owura Peter Obri yeboa naso onye beti echi na nkwenhye na embo na ya odmapo nenu efo wo finfi mantom han nsam ne bi.
I wish to express my appreciation, the appreciation of the Ghana Health Service Council for you being the face and the backbone of Ghana Health Service. Prof. Chair, I think we are gathered here to do a performance review of last year activity. And I think embedded in this is doing our slot analysis. By slot analysis, I mean looking at our strength, weakness, looking at the opportunities that are available for us to take, and then looking at our threats, and then how we'll be able to face them to move forward. And also embedded in this is doing our need analysis. And I'm sure most of us here are always doing that. Also, in this, we need to also look at some few things. In governance, corporate governance, one of the few pillars is what? Transparency, accountability, fairness, and equity. And I believe that as we do these reviews, some of the things we look at should be that if you are the head of the institution and if you guide yourself by these pillars, I'm sure your people will always follow you and you will always succeed. So let's also take note of that. So as we do this review, I expect that when we do the peer review, it's not to us blame people or find fault with one team or the other. I think the most important thing is to learn. From what others are doing right, and also take opportunity to correct what we are not getting right, so that we can also improve on what we are doing. Prof. Chair, I think one of the things we should look at to take advantage of the policies of the government. How are we preparing ourselves to embrace that? I mentioned already doing our SWOT analysis. How are we going to take opportunity of it? And I've just mentioned some of them. As I mentioned already, the primary health care, something that we are already doing. Now we are highly free. How are we prepared to take advantage of it, to grow our various institutions? Because I believe that by now we should have done our mapping, we should know how many people and us, when I say and us, I mean the clients, how many people are hypertensive, how many people are diabetes, how many people are asthmatic, and how many people do we even have to engage in daily or weekly physical activity. By now we should know that, because if we don't prepare ourselves, by the time the thing is launched, those who are prepared will go ahead of us. And by the time we get up the cake, I'm sure most of the cake will have gone. You only have to enjoy the small one that is left. So let's prepare ourselves very well so that Ghana the primary healthcare will definitely take off. And as soon as it takes off, we'll be one of the first people to take advantage of it. The other thing I want to mention too is the Ghana Medical Trust Fund. Some people refer to it as Mama Care. I don't personally, because if you seek a need to it and that person is not there, then people want to throw it away. I think the trust fund is, for me, is the best. Although we all know it's Mama Care, but as we sell it, I think we should sell it as Ghana Medical Trust Fund, so that people will not do politics with it. The most important is for us to benefit from it, and it's good. It has a lot of benefits. So please, as we go, let's sell this and prepare for it. Again, if we don't do our preparation, know the population that we are selling, we will be able to take advantage of it. Our director has mentioned the 24 hours economy. Let's take advantage of it. If you are running 24 hours, it's not just helpful. Some small restaurants, some small sports, and not only application sports. Something that can also generate something for the unit and make the place vibrant. Because if you are running 24 hours and your place is good, I'm sure you can even have a small market close to the place.
Na owura Peter Obri Yaboa ne nsamno na ebegina do na yede donkro kasebo o Coastal Television yede aba ewiyi yemfa seda papa no yemfa ma Nesto Ventures and on the gift shop asenen biso nkoma oye NPA National Petroleum Authority osi use gas edimo ko wona dawo ma na nwabi wuso masen mamede donkro kasebo madabrahum Filippo na ojina camera nature na oye Uncle Ben no so otinchi we fini na me ya bre na daje mate don kro kese bo me de bre hu de busia ba from kitikeku ASORBA KOFI ESSUMAN